Yeah, let's let's take a step back for a minute and talk about our health authorities. You know, in terms of statistics, I think when we look at a source like the WHO or the FDA or any Ministry of Health, we have to scrutinize some of these things. You know, here in the United States, as you probably know, the U.S. government is now $30 trillion in debt.
Yeah.
And so I think we want to ask ourselves a question: would we trust a government that can't balance their checkbook with health advice? You know, if they can't balance their checkbook, do we really want to take medical advice from them? Case in point, we go back several decades, and the advice from the government here in the US, including other governments, was fat is bad, so go on a low fat diet, and that's going to solve everything. So if you're overweight, fat is obviously the cause, go on a low fat diet, and then they gave us the food pyramid. And what happened? We entered into a generation that is morbidly obese. So by going on and recommending low-fat diets, we have here in the United States, 65 to 70% of the population is either overweight or obese, and there has never been higher risks of heart disease, cancer, and diabetes. So all of these things, cancer, surprisingly, is linked to body fat. Some people will find that surprising. You know, what's the connection there? Well, there definitely is a connection because excess body fat, especially around the waist, is going to set off a cascade of increased inflammation, and this will weaken the immune system over time and make people more prone to diseases like cancer and autoimmune disorders. So
Yeah.
very clearly, you know, the advice that we were given about going on low-fat diets did not help. So we have to really scrutinize these things.
Mhm. Yeah, no, I mean, for sure there, and it seems like, well, where do you find the truth? And from your standpoints, what are some of the sources? I mean, we know that it's a problem. We know that it's a huge issue, not just in the United States, but globally. And so we can gather that. But in terms of your recommendations for, okay, so now where do we go for these types of recommendations or this type of help? What would you suggest for that?
Yeah, so first thing, this is a good point to say that I am not a medical doctor. I'm an inventor, I'm a researcher, and health and fitness has been my passion since I was a young teenager. And so I have spent 50 years, now almost 50 years, doing research in health and nutrition, speaking with doctors and scientists all over the world. And I truly enjoy sharing all of this information with our lightweight community. So, you know, my recommendation is that anyone that would be on here today take some of these recommendations, go to your healthcare practitioner, and structure a program that's right for you. So, people are going to be in different circumstances in life with their age, their level of exercise, pre existing conditions, are they on medications? All of these things have to be factored in. So, what would be good for one person might not necessarily be good for another. These are these are all things that need to be taken into consideration. But what we will do today is talk about what are some of the causes
Yeah.
that are surrounding cardiovascular disease, and then most importantly, what are some of the natural options that people have to address the problem. So instead of taking a blood pressure medication that is not going to solve the problem, instead, what we want to look at, how do we actually treat the root cause? So let's see if we can understand what the root cause is based on information that's already available, and what those answers might be.
Oh, that sounds amazing. Yeah, I think that's a perfect place to start. So yeah, what are the root causes, and what are some of the things that you think are causing this issue globally?
Well, it doesn't matter what I think. What matters is what do the facts tell
Yeah.
us? What do clinical studies say? And what does the evidence point to? So let's go ahead and take a look at that, right? So we're going to make this all fact-based. So first, let's go ahead and define the problem. And this is going to be apparently obvious to most people, but it's still worth covering so we have a place to start. And as Jeff mentioned, if we dug into each area of heart disease, if we were talking about the buildup of plaque, inflammation, other factors, this could be a webinar that would last several hours. So this is really going to be an overview, and we're going to go through some of this information quickly because we have a tremendous amount of information to present. But at least it will give you a good understanding of the problem and a number of different methods to address the problem. The other thing is when we're looking at heart disease and having a healthy heart, so this is not just about treatment, this is also about prevention. There are many ways of going about prevention, and we're going to dig into that in quite a bit of detail too. So, of course, conventional wisdom is you have a healthy diet. What does that mean? You have exercise, you get proper rest. These are all different tools that you have for maintaining the health of your heart, but there are many other tools. So let's dig into this. So the first thing is, let's talk about how a person might be at risk for having a heart attack or stroke, and what might we do to prevent this. And I'll tell you right now that if you know that you have heart disease and that you're at risk for a heart attack or stroke, the good news is that first you'll have enough information after this presentation to go speak with your doctor about a number of different options. That's one. Number two, if you have significant buildup of arterial plaque, and maybe you're at a point where you need surgery, you need bypass surgery, there are non-invasive methods that we'll discuss today for removing the arterial plaque without surgery. This is now proven in clinical studies. So this is potentially important life-saving information. All right, so what happens here? Well, first, in an individual that is young and healthy, we have oxygen-carrying blood going through the arteries without any type of restriction. Over time, there can be, with age, we can get an accumulation of plaque that builds up in the artery, reducing blood flow, and eventually causing a blockage. Another thing that can occur over time is that the arteries become more stiff and less flexible. So these are, of course, highly undesirable circumstances. Anytime that we have structure in the body that is not meant to be there or not part of a healthy body, such as arterial plaque, we're going to have inflammation. As an example, two inflammatory markers would be fibrinogen and homocysteine. Some of this can be genetic. So, for example, in China, there are regions in China where, from a genetic perspective, people are more prone to having elevated levels of homocysteine, and as a result, they're more predisposed to having heart disease, even if their diet exercise are in line. And of course, there's things that we can do to get inflammation under control. But these are some of the things that we look for. So, for example, if you went to your doctor and you were to have an inflammatory panel done, you could look at fibrinogen, you could look at homocysteine, and if these inflammatory markers were elevated, then that would be a warning sign that you could have an increased risk of heart disease. Another thing would be to use ultrasound. So, for example, you could go to a practitioner and they would apply ultrasound to your carotid artery, and you could actually